Hi everyone, Dr. Jeff back with this week with Alexis, and actually it's Alexis last week. This week she's off to BC next week to complete her second part of her 4 months of her 8-month work term. Vancouver is a great place to be in the summer. Lots of fun, not as much fun as being with us, of course, but sad to see you go. And this week we're actually going to talk a little bit about something we all know about. It's called blood pressure.
Yeah, so we'll start with what is blood pressure. So we have the systolic number on the top and the diastolic number on the bottom. The systolic number is the pressure in your arteries when your heart is pumping the blood out. So that's measuring the pressure on the walls of your arteries. The diastolic is the pressure in the walls of your arteries when your heart isn't pumping, so when it's relaxed.
Mm-hmm.
But today we're going to talk about why do we take it on both sides?
No, that's a good question. I'm not sure. I know here we generally try and take it on both sides, but a lot of family doctors don't take it on both sides. But it's important because the difference between sides, that can mean that there's something going on, something health-wise going on. Your left side is always going to be a little bit higher because your heart's over there. But if it's more than 10 to 15 millimeters of mercury higher or more on one side than the other, that could mean a couple things. One, you could have some cardiovascular disease, which means you've got the old term hardening of the arteries, creating some plaque buildup in the arteries. And the other one could be mechanical, and that we talked about thoracic outlet before, but the subclavian artery has to run through that tunnel and that first rib or muscles, and you sit like this all day, those muscles can actually pinch it down, and again that's going to occlude it, and that can increase the pressure in it.
Yeah, so if it's cardiovascular related, you might want to see your family doctor and they'll do some testing to look into that. But if it's mechanically related, chiropractic care can help.
Yeah, so if it's cardiovascular, you really want to get it checked out because you're at increased risk for stroke and for cardiovascular disease if that's the issue. If it's more mechanical in nature, that's something, again, in chiropractic we can come in and we can relax the muscles, we can do some adjusting of that first rib. But we want to make sure what it is because we want to make sure we're getting the right treatment and it's done safely and effectively.
Yeah, so next time you're taking your blood pressure, having it taken, you might want to have both sides done so you can compare.
Yep, be a good idea. And if the doctor doesn't do it, you can always ask.
Yeah. And thank you guys so much for watching this video. If you liked it, don't forget to leave a like. Comment if you have any ideas for future videos. Don't forget to subscribe. And as always at Goals Worthy Wellness,
We got your back.